So without further ado, let's welcome up Dr. Shane Morris to the stage. Bring it on up. He hates it when I read his bio.
Oh, goodness. It is hard. Well, good early afternoon. So we're all here for a really, really important seminar, as you all know. And I want to do a quick survey. So how many of you in the audience, by the raise of hands, are women? Let's see. See, that's a pretty good turnout because it's not just important for you guys. By the raise of hands, how many men in the audience wouldn't be here if it weren't for women? On this planet, even. Right? We wouldn't even be on the planet without women. So it's important at so many levels that we have to deal with it. And one of the things that really makes it more important is not only the patient aspect, but because this is an issue and can be an issue as we age, especially in the women, and men suffer some of the same things, and that's for a different intensive. We have to start looking at it in the younger ages. There's no question in our mind, right? The younger you go, the more impact you can have on them. And when you look back in the story, I think Sarika mentioned in her talk that it's interesting to think about women and how we live longer. And I've heard my whole life that women always live longer than men, but that hasn't always been the case. You go back to when this word was created, right? And I'll show you on my slides. You look at this word, and that has Greek origins that then were translated into Latin. But the Greek origins, there was very little writing about it in ancient text. And one of the reasons is it was hard for women to live into their 50s under those conditions. When you look at the ancient Babylonia and Greek and so on. So that word really, we think of it as pause, but this stands for menopause, by the way. This men, month or moon, the moon cycles, and cessation, right? That's literally stopping the cycles. And there wasn't a lot of writings about it in ancient medicine because of the age of women. Now, that's changed, and we have to take this consideration. Because it is a natural phenomenon. It's an absolutely natural phenomenon under normal circumstances, balanced circumstances. So today's objectives, quickly, you guys, I want to review the hormone pathways. That's always going to be your favorite. You're really going to need to stretch before you do that. Review the hormone imbalances. Quickly review things about PMS. I'm going to leave a lot of that to Jack because he's going to talk about that. Perimenopause, menopause, and postmenopause will be my focuses today. And then we want to look at some brief testing, both in laboratory, and we want to focus on the gamut as we talk about this. So I want you to remember, I might be presenting data here that is specific to people that do functional medicine and so on, but what I really want you to realize is that, as you've heard from Sarika and Nicole in her journey, that there's so many other ways to understand what's going on with a woman, all right? So testing results, again, a lot of those results are going to be based on functional medicine type tests, just so that the interpretation's clear. And I also want to discuss during this talk the importance of the correct use of things like products that we're talking about today, Endocrine, F+, Sarika mentioned F+. That has to be used correctly. We're looking at other products you may use in your practice, as well as biological or bioidentical hormones and non-bioidentical hormones, which many women that will come to you will have or be on these products. And it's really important you know what that means for them. And finally, we're going to talk about some herbalomics. When we get into some of the herbs, we'll talk about what that means. It was wonderful to see what the natural medicine, and especially the Asian, Ayurvedic, the traditional Chinese, really fun to see the emotional impact of those medicines through Sarika. And then from me, we're going to delve into what does that mean at the level of the cell, because we now have the tools to do that. We have the tools to say, take some of those herbs that she talked about, which we will, and identify how it actually has an interrelationship with your DNA. And that's important because in my world, the word herbalomics is essentially, I created it because we have a relationship with the herbs we eat, and we always have. And in fact, we used to have a much better relationship that we need to revisit because we have really focused on redeveloping our attention to food. But when we look at more ancient cultures, they ate way more herb than they did food throughout a given day. And we've lost that. It's an intimate relationship, not just an emotional one, but there's a physiological relationship there. And then we want to talk about microbiome. I'm going to pick somebody a little bit later in the talk. They're going to remind me, because the microbiome is critical to this process, and it's critical to the product that we'll be talking about at the end. But it's amazingly critical to what we're talking about today. And then finally, protocoling. There'll be opportunities again later throughout the weekend. You're going to get more information from Cynthia. You'll get information from Jack and others, right? Pampa. So I'm not going to spend a lot of time there, just a little bit, just to wrap up where we're going. So let's move on. So we want to make a difference. As I quickly pointed out in the beginning, this is an important topic. I think the statistics recently say there's going to be about 50 million women in menopause, right? That's a lot of women in the United States only, right? Now, is that always a bad thing? No, absolutely not. Again, it's a natural phenomenon, but so many cases where when they do have an issue, a symptom that they want to deal with, they're immediately thrown into a protocol that may not be answering the questions that need to be answered for them. And the other difference is we just had, for an example, why this is so important, Systemic Formulas this week just had another Moore's baby. So for those of you that have been to other meetings, other intensives or Sunshine, you've probably heard of Kirsten. She's been up on the stage. She was pregnant. She just had her baby. And it's a Moore's baby, and she's cute and glowing. And Kirsten's convinced that it made a difference. That this is I think our third Moore's baby, if I'm not mistaken. And we call him Moore's baby because we use Moore's and Epic as a prenatal for those babies. And they really, the moms and the babies thrive on it. We have a few now at Systemic. So it's a new thing we've created. It's called the Moore's baby. I'm not sure if that's going to catch on around the world, but it'd be nice to think it would. Nicole mentioned, we do joke about these things we're talking about today, but it is really a serious thing. And for me personally, as Nicole mentioned, our genetics, our familial histories, in my world, there's a lot of women that it's really important to cover the subject, right? It's really important for me. It's important for them, their children, their children's children. And you'll pass it on. I mean, there's, I don't know I think it was Nicole Sarika that mentioned that what happens during embryogenesis and you're flooding that baby with different hormones, if you don't have the proper nutrition and genetics and you're not exposed to all sorts of toxins and so on and so forth, I could go on, you're not giving that baby what it needs during development. Right? That's huge. That's so huge for the rest of that child's life. And then you add to that the xenoestrogens and stresses. Stress is huge. Right? We start off with kind of an empty plate, and I'm talking an empty one, not in the way that we want a clean slate, but an empty one. We don't have any tools. We don't have nutrition. We don't have the right progesterone setup. Right? So all that being said, it's important. There's in my life, so I know it's important in your life, because I cannot be the only one that has, concerns about this particular phenomenon with women in particular, and men too, but that's next intensive. Well, let me get into some things, and hopefully you'll see this more than once, because it is a tricky little thing. It's easy to understand, but I want to show. So here's the ovulatory cycle, and where you can see the growing follicle, ovulation, corpus luteum, and so on. This is the process. If you look down at the bottom, that's your 0 to 28 days, okay? And what I want to highlight here is there's a few things happening, right? I want you to look at some of the hormones that rise and dip throughout your cycle. And it's important to know these things, because when you visit with your clients, you're going to want to know where they're at in their cycle when you're trying to understand them. And if you're functional medicine, you're going to want to test in the right cycle. You're going to want to test in luteal phase, let's say, for progesterone. Because notice where it is over here in the follicular, it's really not very high at all. But right here is where all the progesterone's rising. What leads to these ups and downs, this is the estradiol and that's progesterone, is luteinizing hormone and follicle stimulating hormone, you'll see. So whenever you're looking at a panel or even when you're just assessing your client, know where they are, know what things are happening, and what should be happening under those circumstances, right? Because you know physically this is what's going on in the endometrium, but physically things change throughout, so you need to make sure you're on the right place with your patients when you're discussing this process. Now I want to take another look at this, and the reason I threw this up here in addition to, because these are control points, I want to point out that what drives the follicle stimulating and luteinizing, we're going all the way up to the hypothalamus now. So most of you have heard of things called the HPA axis, right? Hypothalamus, pituitary, adrenal. Right here we're looking at hypothalamus, pituitary, endocrine, right? Or the female endocrine, right? These luteinizing hormone followed by progesterone and estradiol. But my point is, these are control points. These are important control points, as well as the adrenal gland. And I'll talk about that in a minute. But if you're dealing down here in the progesterone, estrogen, and you're struggling and you've been working at it for months, and you might have wind here and there, remember to work upstream and downstream of these points, because if you happen to be doing testing or other symptomatic, if you drive too much estradiol, that actually stimulates the hypothalamus. At normal levels, it shuts it down. Okay, that's a control point. You don't want too much, so the hypothalamus is the control point saying, hey, let's cut back on the estrogen right now because we're going into luteal phase, for example. But if you have a high message coming from the body to the hypothalamus above and beyond the normal levels, and that could be xenoestrogens, it could be they're on oral estrogens or what have you, you're driving this in the wrong direction at that point. Because the hypothalamus has this breaking point where it starts to make more, not less, when it should be making less because of its inputs. So it's important to think about the pituitary and the hypothalamus simultaneously, and the adrenals, and we'll get to that. But again, the same process. This slide is just a little better at breaking it down. You can see, again, the rise in estradiol and then the progesterone and so on. But this is a feedback loop. And remember, hormones are incredibly powerful things. For as much brilliance as they bring us, and for as much as they give us from birth to death, they're like a grenade, right? If I threw an egg out there and said, threw raw eggs out to you and told you to be careful as you're throwing them around, the consequences of that egg breaking is what? A little messy? If I threw a grenade out there and told you to be careful with it, what's going to happen if you drop the grenade? You're going to blow up, 10 people around you. Hormones can be that problematic as well as that beneficial. You need to take these things seriously, right? And things that replace hormones and things that act like hormones. All very, very critical in this process. So here we go. You guys cannot escape one of my talks without getting scientifical, right? And I haven't told you to write this down yet, so you're good. Okay, this is the production of hormones, right? So normally the body is in charge of producing them. And it produces, different hormones in different tissues and organs. And we'll cover a little bit of that. It's not necessarily to go through all of them. But one of the precursors is cholesterol. So just for fun, is cholesterol a bad thing? No, not at all, right? So we're at least getting past that myth, right? That fallacy. Cholesterol is absolutely not a bad thing. It's very important, in fact. Well, here's one of the reasons it is. You start with cholesterol, and then you move into these other hormones, and it's color-coded because these are called mineralocorticoid hormones. Down here you have your androgens, you have your progestions, and if you follow this path, so let's focus down here at the bottom. We have what starts off as DHEA, but it does come from cholesterol, right down through progesterone, pregnenolone actually, and over. Okay, so if you look at these and follow this down, we end up over here with the three most common estrogens: estradiol, estritriol, and estrone, right? So if you look at these are estrogens. Here's our testosterone here. Now, I'm not going to go into the breakdown products much. There's will be a little bit here, but again, Pompa's going to cover some of that later. So be excited for that, because that's going to be really fun. But what I want to do is I want to point out, we talked about the adrenals. What is one of the hormones the adrenal glands make? Pregnenolone, what else? Cortisol. The reason I was, and DHEA, good one. I mean, these are all good, but I was fishing for cortisol. Why was I doing that? Well, if you follow this process around, we actually go to progesterone, and it can go to pregnenolone, which ends up in cholesterol. So you start with progesterone. So when you're stressed, when a woman is particularly stressed, and we hear the term adrenal fatigue, guess what's happening? Every bit of the progesterone is not being converted into what it needs. In fact, it's being bypassed and it's being turned into cortisol because it's above the cortisol path. So when your body says, man, I am stressed out to the max, guess what you're depleting? All of your progesterone because your body's shifting it over into cortisol. So high adrenal stress is burning up progesterone. And why do we need progesterone? Well, we're going to hear a lot about that today and onwards. So the adrenal fatigue, I've just given you a metabolic pathway as to why that term should be taken seriously, right? And the metabolic pathway is you deplete through these body pathways into cortisol, which is right here, by the way. And you can see it comes from either pathway, but when you push all this over to here into cortisol, you lose everything you needed for a nice female hormonal balance. And this is going to show up in those little charts I showed you, previous one. It's going to show up in drops in progesterone, rises in estrogen, and so on. So keep that in mind. That's adrenal fatigue right there from a biological standpoint. And you'll see this one again, don't worry. So just to touch on imbalances of quality of life, let's talk about the PMS, perimenopause, menopause, post-estrogen dominant, and I do believe, if I'm not mistaken, that Danny will cover that as well. Estrogen dominant is really fun. It's really, truly progesterone deficiency is what that kind of essentially amounts to. Other hormone balances, we got oxytocin, testosterone, neurotransmitters. Again, most of what I've just read to you is considered natural phenomenon, but it's when it's happening unnaturally or out of balance that we are concerned, right? When things are in balance, for the most part, we don't struggle as much, but when they're out of balance, we really do have to take serious issue with it. Nicole's story is case in point, right? So, looking at that further, I'm going to run through PMS to kind of set the stage for the rest, but hormones become unbalanced. You had anovulatory cycles. You don't ovulate when you're supposed to. Things don't progress as they should. Estrogen levels increase. Progesterone levels decrease. Of course, there are effects on neurotransmitters. There are also effects, of course, when you affect neurotransmitters, you affect anxiety, nervousness, depression. You also affect the gut-brain axis. So now we're talking cravings and so on, concentration. And then there are other hormones that get involved. So once again, these hormone cycles are all interrelated at some level. Well, how can you check quickly with people and try to understand the difference between PMS and normal, or not anovulatory, but normal ovulatory cycles? Here's a few quick rules. Again, I'm not going to spend a lot of time, but you can record 3 cycles to see if they're on target, when they should be, and so on. Things are happening like they should. Record the temperatures throughout the month. Have the patient record it, because it tells you a lot about what's happening without having to do the blood tests, right? Or the saliva, I should say. Rule out hypothyroid. That's a really critical consideration, because hypothyroidism masks as a lot of these symptoms, by the way. And again, the thyroid does work back to these hormones, progesterone and estrogen, and they can influence what's going on ovulatorily, and it's really the thyroid. Look at cortisol, or at least the way, again, whether you do your testing in office or through functional medicine. And then, of course, the same thing happens here with progesterone and estrogen. Temperatures, these are all things you can do either in office or send out. So before we move on to perimenopause, I want you now you're going to write stuff down. So now we're going to draw, okay? I would take the pink paper in your book that precedes my talk, because I'm drawing a big picture, and I want you to draw all this out. Oops. Yeah, because you'll need to draw a human. All right? So get ready. We're going to draw a human. And we're going to draw them to the side so we can see their mouth, right? So get your art skills out because this is happening. We don't have to draw their whole arms. Don't worry about that. We can kind of make it feminine if you want. It's totally up to you. Depends on how you want to go back and look at the picture. Now, it's a really terrible, mine does not look feminine, so don't. But I drew our eyes too deep. So anyway, we have now, I want you to draw the GI tract, right? From mouth all the way down. You can throw in, the whole duodenum, so on. We can make the colon, let's say. And this. Now, I also want you to, because we'll come back to this picture later, okay? I also want you to draw the female urogenital, because you can take notes on this later. And then, just for fun, throw in the liver kind of in the background, just so we can remind ourselves of it. So one of the things that Nicole and Sarika and others will talk about this weekend is, where do we produce estrogen, progesterone? Anybody want to throw out a guess? Ovaries, corpus luteum, progesterone, right? During the luteal phase versus the follicular. So that's a huge, when women are in the years of being able to bear children, childbirthing years, that's where most of it comes from. Where else can we produce it? Now, let's fast forward to and postmenopause. Now, where is it being produced? Pardon? Fat, adipose tissue, and adrenal glands. Okay? Now, the adipose tissue does not produce progesterone, just so you know. The adrenal glands can, but now we have a situation where, and I don't want to steal too much from Danny, but we now have an area where we can produce more estrogen than we can progesterone, postmenopause. So now we can become, and I have a slide on this, but just so you know, we can drop estrogen and drop progesterone in menopause, perimenopause, and the progesterone drops about 90%, the estrogen drops about 60%. So what does that immediately tell us? You could start entering estrogen dominance and you don't even know it, just through aging, right? Going through that process. And now you add adipose tissue to it, and that becomes another source of estrogen, not progesterone. Okay, so just think about that as we move forward. That's the natural phenomenon, and it might not be balanced. But taking our young lady here, or old, middle-aged, whatever we want, there are different routes for hormones to be given. Let's say you have a patient come in and they are on hormone replacement. Let's talk about a few caveats. If it's hormone replacement therapy, and I think others will kind of go through this process with you, but there are so many people that are on it. How do I know that? Go look at the drug numbers, the drug companies that produce estrogen and progesterone and the synthetic versions of it, and they're selling billions and billions of dollars worth a year. So there are many, many people that are on these things, okay? Like it or not, you're going to likely see somebody. So what I'm telling you right now at this part is that you're likely going to see clients that are on some sort of hormone replacement in your office. There's a good chance of it. So how are they getting it? Well, they're getting it either oral, transdermal, so you can make you can take, if this is the hormone, they're either getting transdermal, they're getting oral, or they're getting intravaginal. Those are the three most common routes for those from an allopathic standpoint, right? And sometimes functional, depending on whether it's a synthetic or a bioidentical. Now, first and foremost, there isn't a single person that has a brain that has thought about this that would allow you to keep a patient on a synthetic at all, for a day, for a minute, okay? Let me tell you why that is. I'm not going to draw this out for you, but I'm going to go back a few slides. I want to show you guys something right here. I want you guys to take a moment. You might not be able to see it in your book, so look here. I want you to look at, let's pick, let's pick this one. Look at testosterone, okay, as a molecule. And now I want you to look at estradiol. Do you guys see a difference? It's really hard to see a difference, isn't it? I am going to point this out on both sides. I'll be over there in a second. I want to point this out because it's important. Estradiol, from a chemist standpoint, is almost identical to testosterone with the exception of these double bonds. This one has 1, this one has 3. That doesn't change much, does it? In that world, that is so insignificant. And what biologically is the difference between those two is amazingly dramatic, is it not? Testosterone versus estrogen in your body. Now think about that, because if I were to put, and I don't have it here with me, or I didn't want to, if I were to throw on that screen a man-made synthetic estrogen or progesterone, it is so much different than anything you see here. Imagine what that's doing to your body. We don't even know all the things it does. And one of them is Premarin, which is pregnant mare's urine. Well, mares produce a lot of estrogens. They don't just produce these 3. So not only are you getting weird estrogens, you're getting many, many, many of them, and we have no idea the ramifications, short-term and long-term. Progesterone suffers the same thing. So back to that slide, you guys, they're not even close to anything on this entire natural chart. They're so far off this chart. I would recommend that when you have a case that comes in like that, under no circumstances, you must now say, please stop that. There are other alternatives. Get with your allopathic, or whatever you want to do, but the synthetics are no good whatsoever. There isn't a single case found. They increase cancers, they increase long-term side effects, they increase the menopause symptoms. I mean, they're just no good. Okay, so that's the first story. A little dramatic, I know. But at that there's no argument there. That has to happen. So then what are the differences between oral, transdermal, and transvaginal? Well, this one, for the same reasons, if we go back to the slide, and again, Dr. Bump will fit on that, for the same reasons, or some of the similar reasons, we don't want to do the fake ones. If they are on a bioidentical, and you want to keep them on that, or you're working okay with that, that's something you can work with and not have a problem. The oral route, what happens is you take the bioidentical, and hopefully and again, I'm going to make another caveat here. Bioidenticals in compounding pharmacies, you can get estradiol and estriol. Together they work better than just estradiol, because estriol has what we'll talk about later as more plant type interactions, more phytoestrogen interactions. They're gentler, they don't bind as directly, they don't turn on genes, and we're going to get to that in a minute. So go with both together. It's more healthy. Same thing with progesterone. Go with the identical. But these get metabolized by the liver. So when you eat, when you orally take either one of these, whether it's progesterone, testosterone, estradiol, so on, your liver metabolizes approximately 90% of it into metabolites, which means you're only delivering 10% of what you've eaten. And then you have all these metabolites running around in your body that have to be dealt with through phase 1 and phase 2 of liver detox. It's just not a good idea. In fact, I'm not even sure why some of this stuff is still going on, but it is what it is. So there are benefits with transdermal and transvaginal, especially in postmenopause. I won't beat this too far, but in postmenopause, a lot of times the women are only suffering from urogenital, recurring UTIs. Their estrogen and progesterone levels aren't really far out of whack, but they suffer. They don't get lubrication. They get more frequent UTIs and so on. There's displeasure, and that can be dealt with just with that localized situation. Now I'm going to pick you. When I get to an herb that you see on the top that's Wilfortii, so it's going to be in my slide or in there, and it has the word Wilfortii in it. You're going to stop me and remind me about the urogenital, okay? You'll have to do that for me. All right, so why else am I drawing this picture? Well, we want to look at, so the liver is one of our problems because now when you take it orally, the liver sees it, and of course, it's going to metabolize, and now we have metabolites. Transdermally, and here it's not processed because it doesn't go down through the portal vein and get processed till later. So there is some positives. But why else do I care about this? Well, guess what? One of the things we're going to talk about as I progress is not hormones, because we don't want to prescribe hormones as systemic formulas. We can't do that. So what do we want to look at? The new products, F+, these are called phytohormones or phytosteroids, right? These are all plant-based. And it's important to know that the oral route and the transdermal, in this case we're just talking about oral route, this process here, through oral, through the intestine, especially the intestine, and the liver, all three of those are beneficial to the things we're providing in phyto products, right? So the opposite effect is true from oral hormone. You're getting benefits through the process. And I'll touch on that more, but I wanted to show you we're getting benefits. So on the phyto side, so phyto, P-H-Y-T-O, geez, good, good. Hormone, or HRT, this process is bad, okay? Because this, and again, I would tell you, and I have no proof of this, but it's because of the relationship we have with these phytoconstituents that this is good. Because how did we develop a relationship with phytoconstituents? Orally, right? For as long as we've used food and plants, we've done it orally. Occasionally transdermally, but most of it's orally. So that's why this relationship is a good thing. It's a very good thing. It converts them into an end product that your body is happy with. Your body is not going to have a hard time processing and so on and so forth. All right. Now, next to this little graphic, I want you to draw a cell. Okay? And I'll draw a double wall cell. Right? Then here's our nucleus. In the nucleus, I'm just going to write the DNA. Okay? So that's our nucleus. And I dropped markers. We're going to have more markers here. I want you to draw a receptor on the cell. Now remember, receptors are on the membrane. Okay? And, oh, by the way, there is a little tiny membrane around our nucleus, which becomes another issue. So how do hormones work? And phytohormones. How do they work? Well, they bind to this receptor, right? Now you can have the estrogen receptors, you can have the progesterone receptors, and as you know from other systemic talks, receptors are the way to communicate with the cell through any compound. You can have vitamin D receptors, vitamin A receptors, you can have all the peptide hormone receptors. Receptors are ubiquitous, and they are the way that your environment, your world around you, communicates to the DNA. That's what they do. So you're going to have to draw this, but it's going to be hard because you're going to have it's animation. We're doing animation. Okay? You'll like this, I swear. I should have practiced, so I'm kind of making it up. Once the hormone or the phyto binds to this, then it engulfs it into the cell, right? So now we have, I need more fingers, that's what I need. Now we have the complex. This complex transits all the way to the nucleus in many cases. On the nucleus, it turns on a gene. The gene then makes RNA. Okay, now you're learning all sorts of crazy stuff. Now we have RNA. That RNA now makes a protein that goes out into the world. That protein is what your hormones do for you every time you get a message. That protein could be, I'm going to make the protein out here, it's kind of glob. That protein could be an enzyme to digest something. So, gastrin, when you eat something and it tells your body to do, that message goes to the cells in your stomach, hey, send out the acids, send out the enzymes, you need to digest this food. That was a message that was translated into an action. Everything that happens in the cell happens in this fashion. And hormones are one of the most powerful ways of doing this. So when you give somebody a hormone, you're going to get an output, are you not? You could start menses, you could stop menses, you could stop a pregnancy, and so on. These things are so powerful, but this is how it works. It goes down in, it talks to the DNA, and then it tells the body to make a message. That's how they work. Why am I telling you this? Because we have natural products, non-hormonal based phytos, that do the same thing. Or, if we want to look at this in a different way, where's my blue in my hand? Okay, so over here I'm going to draw a blue receptor. And my phyto, I don't want this message to be sent because estrogen is sending this message too much. We're high in estrogen. So in my phyto world, I can block this with the phyto, and this actually cancels the message and doesn't allow estrogen to bind, right? And there's different kinds of receptors that bind different things. So as I progress through this talk, you're going to have I'm going to refer to things, and there's different kinds of receptors. There's ER alpha and beta, and they tell different stories in your body. They tell you to make different things. So as we tell them to turn on or turn off or turn on, we want it to be making messages that we want it to make, not messages it doesn't. If you're high in estrogen, you're making a lot of things you shouldn't be making, which is why you have breast tenderness, which is why you're anovulatory, which is why when you're estrogen dominant, you end up producing things, I think Nicole said this, that leads to cancer cells because you don't turn them off. They keep making. And progesterone is the one that causes you to say, hold your horses. This isn't necessary. We don't need to keep reproducing these cells. So this phenomenon, cellular phenomenon, is wonderful to understand why we've put things into our products, right? This is the herbalomics. This is the information coming from the herbs and nutrients speaking to the DNA, telling it to make good things, to not make bad things, right? And you can call these competitive inhibitors here or agonists. So if those of you that read articles, this would be an agonist. When it stimulates, this would be an antagonist. It would stop a process. So what did we do? We need to find a balance. We need to find a balance with these phytoconstituents so that we stimulate progesterone when we need to, we reduce estrogen when we need to, and we don't overwork either way. And then we can also work on things like the metabolites, or what's coming out on this end. Okay, so this is the science. And if you wrote that down in your book, you can refer to it, and you won't want to scream later. All right, so let's get into some of the fun now. So the imbalances in the quality of life, I mentioned this. If we look at premenstrual, because I jumped back, let's go to perimenopause. So just a couple of classifying notes. It's not going to be, these are just for you to read, but estrogen is produced mostly by the ovaries. I mentioned that. Same with progesterone, but it doesn't have the adipose tissue key. And then, of course, we have the other thing I want to bring up right here that I brought up before is look where they're produced post-menopause, perimenopause, and menopause. Those two hormones are now produced by what gland? The adrenal gland, minus the adipose tissue. And what are you stressing out when I said about stress? The adrenal gland. These are tied in. What is this circular reference I'm going to keep making throughout the day? The circular reference is gut. You can call it gut brain if you want. Brain. And we'll call it the HPA or the androgen or female hormones, okay? There's a circle here, and they're intimately connected. And if you want to go take this from just an emotional look at it, what are the three things that get most affected by an imbalance of female hormones? Brain, depression, anxiety, and so on, and the GI tract. They're intimately related, you guys. This little circle here, you can't get off that circle. That is a natural circle that you have to stay on. And we consider that when we're looking at the herbs and the nutrients that we want to apply to something like the new product. This is fundamental to our thinking. All right, so if we look at the result of during perimenopause, these things start to fluctuate. You start to lose. You don't go through the whole cycle fully, and you don't go through it all the time. And so now your hormone levels are all out of whack, right? You're not producing, the corpus luteum is no longer producing progesterone. So estrogen is dominant for a while. Then when estrogen drops, and so on, right? So this gets, and then you stress out, now your adrenals are shot. So this is good to know. But after, now we really start to plummet. Once you no longer ovulate at all, these levels drop in the blood significantly, and in the saliva, and so on, and in the tissues. So when you start dropping them both, and I mentioned before that one drops more than the other, we have to be considerate of that. We have to be considerate of the progesterone drops further than the estrogen. Oh, and by the way, I should mention that we can still make it from DHEA, but again, the DHEA is produced in the adrenal glands, right? I keep referencing that. So let's look at natural versus unnatural. This is a consideration, again, in the office, more than it is for me looking at systemic formulas and what to offer to you guys. But this is a consideration for each of you in the office, because you have to look at what is the cause? What is the underlying cause? You can't just go after symptoms again. You've got unnatural menopause, surgical removal of ovaries, orectomy, hysterectomy, ovarian cancer. Now I want to mention chemo and radiation anywhere in the body causes this problem. It doesn't have to be in the urogenital tract. Chemo, radiation, anywhere, any kind of cancer treatment will throw these people into what's essentially early menopause, okay? Pituitary gland, hypothalamus, which isn't as common, poor nutritional status, and xenoestrogens. This is a big one. Xenoestrogens is huge. It's becoming more and more prevalent, and then you combine that with things like heavy metals and so on, you're going to have a lot of challenges right out of the gate. Xenoestrogens are being found everywhere. That same group of people that I'm following with, showing how many progesterone and estrogen synthetics are out there, they're also tracking these synthetics in the environment. And synthetic estrogen in the environment is everywhere. You can find it in every water source. You can find it in every soil, because it doesn't degrade. Remember how I told you it's not natural, and it doesn't look like those other ones? Because there's nothing that can break it down. You don't have the enzymes. Nature doesn't have the enzymes. So it persists forever in nature. So when you drink water, or you're recycling through, your water treatment plant has to recycle and reuse, you're going to be seeing these xenoestrogens in the environment. And then you add to that plastics, BPAs, the different styrofoam, polypropylenes, and so on. We're compounding the issue. And the younger you are, the more compounded it becomes. All right, oops. So the clinical descriptors, this is just a short list. You guys can have your own long list. No period for 12 months. This is important for most people that are dealing with patients coming in, and they do functional medicine, because this is what they use to kind of guide their testing criteria. You have your, like Sarika said, you have the patient. Use the patient, right? You can have as many checks in your head or checks and balances, but use the patient. That's critical. And I can promise you that when you listen to Nicole's story, and it's not unique, the patient is paramount, because they are the ones that have been miserable, and they're the ones that we have not been able to help, whether it's you, whether it's me, whether it's their OBGYN, whomever. They're the ones that need the help, right? Not their hormones, not their bladder, not their, they need the help. Keep that in mind. All right, hot flashes, sweats, these all have a really important role. And for me, the reason I wanted to put them up here is I want to show you guys that some of the things that we have, again, in nature, some of the things we have in this product, the studies done on the herbs were done for these reasons, not because they were monitoring their hormones. They were improving the life and the quality of life for women, right? Those were the studies where we improve the quality of life. So we have both. We need to balance both, the quality of life and what I'm trying to show you is more of the behind the scenes and how we get to where we get. All right, so let's talk about the dominatrix briefly. I want to kind of set Dr. Pompa up with this. I've hit some of this, but remember, it works through many factors. Now, estrogen's a good thing in balance, so is progesterone. And remember this little circle up here? It's right here. Estrogen and progesterone both help brain function. They both help cognitive function. They both help the second brain, the vagus nerve. These are not, for example, it affects neurotransmitters, acetylcholine. The progesterone affects serotonin and GABA receptors. It actually does. So that's why when it's off, we can have anxiety, we can have depression. There is an intimate relationship between these hormones and neurotransmitters. That shouldn't be forgotten. When you are in dominance, and you'll get a lot more of this, it's critical. There's things like iodine deficiency in that level, right? Breast tissue iodine deficiency, it's actually problematic because it needs the estrogen binding and progesterone in order to work, which is why breasts become such a problem for estrogen dominant women. And that's where cancer starts to really come into play. All right, I mentioned this too, but I just want to remind you, based on the work that we've done on these herbs, we had to look at the alpha, estrogen receptor alpha and estrogen receptor beta, because they behave differently. So although that's way more than you need to know that that's what we looked at when we were looking at these phytoconstituents to put in the product, because we don't want to drive too much alpha. Beta has a protective effect on alpha in the body. So that's what we wanted to focus on. So I mentioned this earlier, and I want to recover it. In office, we have questionnaires. You can do diary for, and that took me a while to spell check, diary versus dairy. That is diary, I swear. Skin, hair, the cycle, again, recording temperatures and cycling, all that. You can work with your patients, and you haven't even gotten to laboratory tests. Applied kinesiology, and I think Sarika mentioned some equipment. And then laboratory tests, these are wonderful hormone panels, neurotransmitters, estrogen metabolism, and genetic tests. Let's look at a few. Since I made my slides, though, I have had more experience with different labs. And so I've thrown one up here from SpectraCell. The other laboratory I've worked with now is Labrix, and I really do like their panel as well. You just go on and check them out. This is just they do things like, I threw it in here, yeah, it didn't show up. They'll do things like a ratio, the progesterone to estrogen ratios and things of that nature, which are helpful if you do functional medicine. You can't see the ranges very well, but they have ranges, and some of these ranges are huge, so you still have to get to know your patient because the range is so wide, you may not learn what you need to learn if you're doing some of these tests. But it looks at some of the work. This one happened to be done on a person in follicular, but there's really more information in the luteal in many cases. So remember, you have to pick when you're doing it. And it's assessing different things. So there's 3 estrogens. This only looked at 1. In my world, that's not information. You want to look at all 3. Because the estriol has a protective effect with estradiol, right? Estrone is not that important, and we'll talk about it in a minute, but progesterone, we got the follicle stimulating and the luteinizing hormone. See, those give you some look at the pituitary, briefly, right? Just a window. See how the pituitary is functioning. We can look at, and as we keep going, DHEA is the adrenal, cortisol would be adrenals, and so on. So there's some information here, and there's different tests that people offer for female panels if you do functional medicine. Oops. This is a quick one. Again, I just wanted to show you that you have to be cognizant of the metabolites. And Dr. Pompa is going to spend a lot more time on this. And in my world, the metabolites, for me, I was interested in it because I was looking for the right kind of herbs, right? These are estrogen metabolites, but I was looking for herbs that had an impact on these. And some of the herbs we're using have an impact on this process. What I'm saying is they affect the enzymes that turn the estrogen metabolites into the bad guys. There's bad and good. If we can affect the enzyme that turns them into the bad guys, you won't be making these metabolites that wreak havoc on your body. And there are plants that do that, and we've chosen those plants. That's why I'm interested in these. Clinically, Dr. Pompa is going to get into why you would be interested in them in much more detail. But it's fascinating because it's really important from a research standpoint how to pick the plants that are going to do what you need them to do because nature will provide. Well, what does that look like? For me, these are all the metabolites. Again, I won't spend any time on that, but down here, they form what are called DNA adducts. Well, that's another big scientific word you guys probably never use again. You can write it down if you'd like, but what is a DNA adduct? A DNA adduct is when this compound binds to DNA, and it doesn't come off. When you bind something to your DNA and it doesn't come off, and then your machinery comes along, now that machinery runs into that adduct and breaks the DNA. Or it pulls it out and puts the wrong thing back in. What do we call those? Mutations. When we break the DNA, what do we call that? Mutation. We start to introduce into your DNA mistakes. Now, let's say you're pre-menopausal and you're still in childbirthing years. And you're getting these DNA adducts. Well, you're getting them in your eggs. You're getting them in places that could be passed on to the next generation. Okay, these are mutations that can be passed on, but you can get rid of them by not creating these adducts. And these adducts come from these estrogen metabolites, right? So you're doing yourself a huge disservice in this process, and your potential children if you're still having children. Okay. So interpretation. Well, this is an interpretation that I threw up there based on talking to 3 clinical labs. And I don't know that other clinical labs may have a different interpretation. This is not a hard and fast rule, but it's believed that salivary hormones, the steroidal hormones, testosterone, estrogens, the different estrogens and the progestins, are best determined in salivary because those are the free hormones circulating in the system. If you do serum or blood, they're bound or they're tied up and you can't get an accurate number. And by the time they elevate, you're going to miss things like PCOS, polycystic ovary syndrome, because by the time they're high enough in the blood, they've been wreaking havoc in the woman's body. In salivary, they peak much earlier when you start having androgen problems, like testosterone and so on. So this is their, and I'm fairly confident they've done their homework. But there's still reason for serum to look at other things, but the salivary is the best. For those are the free. But you must do different ones for different questions to be answered. And I don't have it on here, but for example, urine. Why would we want to do urine hormone panel? May not tell us active like the salivary would, but what is it great at? Metabolites. Right? You're not going to get metabolites anywhere else but the urine because it's already been processed. So that's why they do this, the functional people. More interpretations. This is a quick. I don't know if anybody else is going to cover this. I'm certainly not going to spend very much time on it. But high testosterone levels or high androgen levels for women in this same process can lead to insulin resistance. And it is associated with insulin resistance in PCOS. So when your androgens go way up, testosterone way above normal, and stay there for a long time, you are going to be in a state of insulin resistance. Again, that's the relationship we talk about here. The gut, brain, and the HPA, they're intimately involved in each other, and insulin is one of those hormones. So genetic influences, Nicole talked a little bit about a full panel. If you don't do a full panel of genetic screening, you can do smaller panels of genetic screening like these, for example. You can do the CYP genes, you can do cytochrome 450, you can do phase 2, COMT, glutathione enzymes. What is phase 1 and phase 2? Phase 1 is the first part of the liver that is taking the compounds that are circulating in your blood that your body wants to get rid of. It could be xenoestrogens, it could be estrogen, it could be other hormones. It's certainly getting rid of all the toxins you've produced and or your diet or exposure is producing, right? Phase 1 is your first line of getting those things out of your body. Phase 2 is the secondary to change the phase 1. What does phase 1 do? It hydroxylates, it hydrolyzes, it reduces, it oxidizes, right? That's what it does. It's a really reactive part of your liver to get rid of toxins. The second half of your liver is what's called conjugative. It adds things like glutathione to a bad guy so that your body goes, whoa, he's no longer just bad anymore. He's got glutathione on him, let's get rid of him. It adds things like sugars to get rid of them. It adds things like methylation groups to detox. We've heard about methylation depletion. That happens in the phase 2 liver detox process, right? Those are called conjugated sides. Well, that being said, you can actually test for genetic shortcomings in individuals where you may not have the full tools to get rid of or detoxify things because you've been given the short stick, so to speak. You have mutations in these enzymes that need to be helped along. So how do we do that? Well, we can do that nutritionally, and we can do that herbally. We can help that in both ways. We can help these enzymes. And we have the best tools to do this. No other healthcare or medical group has the tools that are needed in this process. Herbs and nutrition is the best two ways to do this. No bueno drugs actually complicate this because your body wants to get rid of drugs. And so your drugs tie up these processes and make further problems, right? It's one of the areas that things like antibiotics and hormones, they muck this up big time. All right. So you can get those tests done, and they're really not that expensive, and they're becoming much more available for lots of practitioners in lots of states, too. Well, let's start to wrap up a little bit of where I started on my objectives and narrow down in. Now, we've done a lot of physiology, biology. We've introduced a little bit of botanical information and nutritional, but let's dig deeper now. Forget these for a second. I want to go through the process here in a minute of what these do and how they're beneficial. And it's really fun to be behind Sarika because, as she and I did speak, when you look at the traditional Chinese approach, it's phenomenal then to take that. So for those of you that, whether you practice energy medicine, traditional Chinese, Ayurvedic, allopathic, and or functional, whatever you practice, what you can know is that we're able to link them. And I think Nicole made that point. I looked at these that Sarika was able to kind of work through and understand from a Chinese medicine place of healing and look at what do they do to us at the cellular level. And they do things, you guys. It's cool. We have an amazing relationship with these plants. It goes way beyond how they make us feel. Because they make us feel by going in there and speaking to your DNA. They do that little chart I drew where they bind to receptors and they turn on genes and they turn off genes and they make you take on more serotonin and they dopamine and they help you produce more acid when you're digesting and they help you run harder because they've helped you make more ATP, right? So they do all these things and they do it at that level. So it's really fun to hear from you guys from the energetic or the traditional and say, you know what? I'm going to look into some of these. And the peony, I'll just tell you now, the peony has an amazing effect. It raises progesterone. So it binds to things. We don't even know how. But peony raises progesterone levels. Subtly. You know, it doesn't shoot it out the roof so you're like now progesterone dominant. It's subtle. It's natural. So how cool is that? When you look at what she said that it did symptomatically or, you know, as a whole human being, it makes sense, right? It's wonderful to see those things. And we'll talk a little bit more about some of these more, but that was really fun for me to see, to go deep into these as opposed to just the symptomatic side. And they're powerful, and this product's going to be powerful, so you're going to have to start with probably one dose, one capsule, even though we've said 2. This is the bomb. Right? This piece right there is what separates what we're talking about today from what you've heard from maybe anybody else. There's going to be things about this product that you've seen and or used. You probably haven't seen or used them in a combination, which is one unique thing we're going to deal with. But these herbs, their power comes from this right here. And I'll tell you more about that. That's where it's happening, okay? And that's where the future is headed for many, many aspects of what you'll be hearing at our future intensives and so on, is right here. And there's a new one, by the way. So in the past, we've introduced virome, which are the viruses that live among us, microbiome, or biota, which is the bacteria, and we now have a new one that we're studying called the mycobiome, M-Y-C-O biome, and that is the fungus among us, right? Those are the fungus that live with us. So these are all amazing new developments. And really what we're just finding out is what has always been. We just now understand it. So as we move forward then, we want this in balance. We have to have this in balance. There's just no question, right? So to review, this is the balance we're trying to attain, and we want to attain it through separate pathways that influence this in a more natural way. So I want to take plants and other, let's say, bacteria and influence the way your body responds to estrogen, progesterone, testosterone, and that's really where we're headed. And again, we're not creating something new. We're taking care of what we've always had in our world. We're actually revisiting what we used to have before it was TV dinners and high-stress jobs and plastics, right? I'm going to pick on those three. They can't come and take me to jail, I don't think, can they? TV dinners at least have died, thank goodness, but yeah. McDonald's and those guys haven't. Let's start off. So what makes this really cool? And this is the herbalomic side of things. And this gives you guys an insight into why these plants are cool. And there's more than this. I'm just giving you a taste as to why we care about these plants. So let's look at Norway spruce, which I'll talk about in a minute as being part of your future products. But Norway spruce, fantastic plant. Let's look at a couple of publications. Here's the publication if you ever feel like looking it up, and I have many more. But what does it do? So it competes with the estrogen 2 alpha receptor to induce sex hormone binding globulin. So what it does is it improves, lignans are produced by this plant. You then convert lignans into something that binds to the estrogen receptor in your body, as we talked about. And then when it does, it actually induces sex hormone binding globulin. That is a protein. I know now I'm throwing new things at you. Is it a protein that binds sex hormones, estrogen, testosterone, and progesterone? Why does it do that? Because it keeps them protected so they're not running around turning things on and off. Okay? So it's a good thing. We want that because when we start to have too much estrogen and too low progesterone, we want to bind it up. Or if you have too much testosterone and you want to bind it up, get it under control. Don't let it wreak havoc. So that's how this plant works. And this plant goes way back in history as to being beneficial for women. Now we're understanding why it's beneficial for women. Okay? Let's look at another one. Hops. Anybody that drinks beer knows what a hop is, right? But hops, turns out, has been around with humans for a very long time, and we've developed quite an interesting relationship with us. More than just what I'm telling you here, by the way. But hops is a P450 inhibitor. So it stops the conversion of estrogen to those estrogen metabolites. Okay? That's how it works. Just take the natural supplements, don't drink beer. I can't condone that, Brady. And here's some of the, what it does shut down. And it shuts that down in a process that we care about. Now, I've also thrown in here, it was studied with licorice. And it seems that, along with licorice, there's a beneficial effect because they affect different estrogen receptors. So now we're getting synergy. Now we're talking about synergism between herbs, right? Let's talk about another one, Cyantium wilfortii, Flambus cimbrosi, Centella asiatica, Angelica gigas. Thank you. So she remembered to tell me to bring something up here. So, what does it do? Well, let's talk about all the different things. So there's serotonergic, oh man, I can't even say that. It helps serotonin receptors. It helps you bind serotonin better, which is what? That's your happy drug, right? People that are on MAOIs, SSRIs, and so on. So this would speak to some of the Chinese improving well-being, feeling of well-being. And actually history proves that. But now we know why. It affects serotonin. That's Angelica sinensis. We look at the Flambus, binds to the estrogen receptor to selectively modulate. Now, I told you earlier that estriol selectively improves estradiol. This selectively improves estradiol in the same way. It binds loosely. It just tells the body, hey, don't get out of control. Don't produce a lot of these things. I'm binding to my receptor, and I just want you to gently turn this gene on. Don't go crazy. Don't run a marathon. Just relax a little, right? That's what it does. Asiatica, same thing. Serotonin, dopamine, they increase. So this is how these things work. But let's go back to this Wilfordian flombus. What I want to point out here, and I'm going to hit this again. So I'm going to hit this more than once, and I'm not even going to apologize for doing that because I really want to beat you up on this. These herbs right here, these four, have amazing effects behind them, both from a symptomatic and a physiological, biological, biochemical. But they don't work without going through the GI tract and being converted by the microbiome. How many people follow that, what I just said? Because it came out really easily, but the implications are huge. Those herbs, as well as others in this formula, do not work unless they are properly converted into active constituents by the bacteria that inhabit your GI tract. Let me say this another way. If we fed these herbs to a woman that had sterilized her GI tract, these herbs would have zero effect on that person. Because the microbiome has to be in place in order to turn these herbs on. So how cool is that? And these four are the most predominant, but there are others in this formula that holds true for. Now I kind of jumped. Now we'll talk about that again in a second. But that is for lack of a better word, that's the bombshell in where we're headed. Right? We've known a lot about these herbs. We've known a lot about traditional medicines. But now we're starting to realize that without the microbiome, there was no chance that those herbs were going to do. Now take and throw into dysbiosis. What happens with dysbiosis? We're not going to get results we want because they're not being converted properly. This is a new wrinkle in our intellect that has been happening. We just now know about it. So when we feed these herbs to, let's say in the laboratory we use sterile mice. These herbs don't become anything that works with these receptors or with these enzymes. They just pass through the liver and get expelled. You have to have the microbiome. Okay? For me, that was the aha moment. Oh my gosh, that is the coolest thing ever. Now, let me just postulate this. How many herbs you think in our world, from neurocin to sinulin to L-liver to, K-kidney, how many of those herbs do you think require the microbiome to actually work? I'm thinking a lot of them. Yeah, I'm thinking a lot more than we realize. Okay? That's the cool part. For me, that was just amazing because when you start with people, and like with Nicole and people close to me in my life, we always go, oh, let's work on the GI tract. Oh my gosh, we're not getting what we need. Let's start with the brain. And you remember the symposium, brain to gut, gut to brain? Well, now with women, we've got to loop in there this thing because there are women that you work brain to gut to brain and you're not getting where you need to be. You've got to loop in this other element. All right. So brassica. This one's well studied. You guys probably heard these over and over again, and I think Dr. Pomp will hit these. These indole carbanols, and they come from brassica species, both the IC3 and the DIM, both available through us, and they are the ones that have been shown definitively to slow down the metabolic processing of like estrogen into bad things, right? So these are really important. I won't beat those up too badly. Let's look at Don Quiet, the senescens. Now, before it was gigas, and by the way, Angelica gigas, Angelica senescens, even though they're both angelicas, totally different in your body, totally different. And during the making of this, and in talking to Cynthia and Sarika, one of the things we really love is the licorice, right? We love licorice. However, we had to pick the licorice that doesn't contain the glyceric acids. Why? Because that drives cortisol. So again, we had to think through the things we wanted and what we didn't want. Because you don't want to drive cortisol as you're trying to help this process. So it's really fun to work with all of you and them, and I should give them credit. It was really fun. You have Dr. Pompa, Jack, Cynthia, Sarika, and I know I'm going to forget people, but it was really fun interacting with you guys. And I'm not a woman, so we had We had to include women. Then I had, family members and the story, the Nicole's, and that helps drive your ambition in this process because it has to happen. But a lot of intellect and a lot of fun with this. It's certainly not, they say Shane, but really, honestly, it's a lot of people, including the rest of Systemic, that helps us with this. So let's talk about Dawn quite quickly. So let's look at this. This is another one, right? So we look at the osteoporotic. So this one we include not because we're trying to manhandle the hormones. We want to start helping the things that these hormones do cause trouble with. For example, the osteoclast versus osteoblast ratio. Osteoclast tear down bone, osteoblast build it. And when you have high estrogen, you're driving osteoclasts and you're lacking in osteoblasts. Progesterone, of course, swings that. There are herbs that help do that, that help drive the normal or the natural balance of building and breaking down so that you don't have that dramatic bone loss that you can have when your estrogen is high. So there are other herbs that we have in there for that reason, right? And these are just little guys. This guy's, the one that's turned on by the estrogen. These are little receptors. Now he's eating the bone. Little guys, you have to wonder. I mean, we all know that we replace our skeleton about every 7 years, right? It's completely replaced. So it's a good thing, but you have to keep that in balance. I'm not sure how I'm doing on time. 30? Okay, so I'll give us time for questions. This is the one that I'm going to give you a test on at the end of my talk. You must know this by the end. So this really visually summarizes the complexity, yet the importance of natural nutritional influences. And not even that many people spend on botanical. We are really a botanical believer. The nutritional world has done some good work that we can piggyback off of. Clearly, the zinc and the calcium, and there's vitamin D. There's a lot of things that we can really embrace from other people's work. But it's the botanical side that is underutilized, underappreciated. And now when we add the microbiome to that, we are really having fun, aren't we? Because that is a new thing that I bet you haven't even heard before. That in order to affect these changes in women in this process, you have to have the intact microbiome to convert these plants into what they need to be. Let me take that one step further. On that microbiome slide, I also had the vaginal microbiome. That is critical that has to happen. Because especially post-menopause, it's critical at all times, but post-menopause, when the hormone balances shift, the vaginal or urogenital takes a hit. It does. And what I can tell you is some studies that, again, these are mainstream research studies, and so they've used bioidentical hormones. And of course, for some of you, you want to get away from that and get into what I've been talking about today, phyto constituents. But needless to say, the studies were this. When they took postmenopausal women and studied the GI or the vaginal microbiome, and they took healthy childbearing women, they found some distinct differences. Well, some of those differences were in lactobacilli and some others. We were able to get our hands on some of those lactobacilli, which we've included. But the other difference they found is that when your hormone levels drop, estrogen, progesterone, it starts atrophying the tissue, the vaginal tissue. It no longer secretes the mucus, it's no longer lubricated, no longer becomes a friendly environment for what we call these fermentative anaerobes, which are the lactobacillus, some bacillus, some Urocodes. There's a whole bunch, Gardnerella, a whole bunch of species that live there happily, and they keep you healthy. They keep you free from the yeast, free from the vaginosis, the other bacterial infections, free from these other anaerobes that are destructive, cause UTIs. Right? It's a really amazing ecosystem that relies upon those hormones. Okay, it does rely upon the hormones. So what the study found is that when they gave women suppository and oral, but oral was of course questionable, when they gave them suppository oral, small amounts of estrogen, they could recolonize and maintain the healthy microbiome. Right? So for those of you that don't want to do that, I'm going to put out there based on that Flombus wilfortii and the data we're looking at with the microbiota, that we can start to recolonize and rebuild that area without having to use suppositories, right? Because now we know that it needs to be done, and there's that reciprocal relationship. We know that whatever those hormones are doing, and it's just locally too, by the way, right? You don't have to have circulating amounts, you just have it right there. There's this interplay. If we can interplay that with nutrition and herbs and get those organisms back, because once those organisms come back, they might maintain better, right? They might help maintain that relationship. It's when they're gone that you lose that relationship. But clearly, those women that were studying, there was quite a few, everything improved in their lives. They got, everything but with the complaints they were having, UTIs and the libido, all those things got better for those women. And so now this raises, and this is new data, by the way, it's brand new data, microbiome data. Now it raises the question, can we do this naturally? And what other obstacles do we need to look at to do this? I'm going to go back to that Flombus. The reason I told you to remind me of it, it's where I dropped the bomb that we have to have the GI microbiome to convert these into positives. Guess what that Flombus was studied? When it was studied in human subjects, guess what it did? And I'm not talking, this isn't biochemistry now, this is back to symptomology. That particular herb improved lubrication, moisture, and helped decrease the atrophy. What does that tell me from a symptom standpoint? So we're talking postmenopausal women. That herb was used, and they got symptoms similar to what you'd get if you were giving them suppository estrogen. So my question is, I wonder if that herb helped improve the microbiota. Because the symptoms were the same. The improvements, I mean. Now, we don't know. No one's going to do that, and those, they're certainly not looking at that any further. But, somebody, hopefully us, will look and see, well, does that herb actually help rejuvenate the microbiota? Because that's the kind of symptoms that it gave, the improved symptoms. Right? It didn't help hot flashes or those things. It helped in the urogenital tract, which means I suspect that it helped the bacteria there too. It helped the probiotics. But it'd be really fun. Hopefully we'll have an answer for that for you guys soon. But we're talking cutting edge thinking with our microbiota, both the GI and urogenital, vaginal, and these herbs and nutrients. Right? I doubt anybody's heard that before. It's pretty fun. If you have, I'd like to know because it's brand new. So the future, and I'll leave a little bit of time for questions, and I think Nicole wanted the other three to come up too. So let's look at the next slide for the future. There's a few futures. So we want to look at the beneficial effects of these organisms. We want to look at how they affect not only the hormonal levels, but levels of other things like homocysteine and metabolic syndrome. And then they absolutely do, and especially for women. There's uniqueness among women. We want to look at these lactobacillus. This is the reuteri or rhamnosus, which you'll see in a minute. We want to look at the therapy. When people are being hit with, at a young age, these antibiotics, we have to repair all this. These things don't just repair themselves that easily. When you start taking antibiotics, it sometimes shifts your microbiota for years. You've got to start replacing it. And we're talking not just GI now, we're talking urogenital, we're talking skin. So this information gets bigger, but it's addressable, it's doable, it's not unapproachable anymore. So these are some of the trials you can get. Let's see. But yeah, with these organisms worked. By the way, the reason I threw this up here is these organisms worked better clinically than any antibacterial, right? They worked better than giving them antibiotics, giving them suppository antibiotics. These organisms work better. So if you get the organisms back, you've actually done what we want to do. Go after the cause, not just the symptoms, right? We've gone after the cause here for vaginosis. What else we got? Well, this is what I've mentioned before, but these things are changed. So here's a journal you guys can read. It's really fun. It's heavy, but fun. Your GI tract transforms things. Transforms them into what you need. Without that, you don't have the millions of enzymes. And I know some of this stuff is coming at you pretty fast, but you have a very limited number of enzymes in your GI tract, right? We introduce pepsin, we lipase, the amylases, you know, there's probably a couple dozen we produce. To just chew things up to make them available from a large molecule to smaller ones, just to get the macronutrients made available so you can survive, or actually make them available to the bacteria. The bacteria produce genomically, just by looking at their genome, the 100 billion you have in your GI, they produce millions of enzymes that convert things you eat into millions of different things. You can convert things into maybe 30, 40 different things. The GI microbiota can convert things into millions of things. We will never know in my lifetime, or probably my children, all the things that your microbiota converts herbs and food into before it enters your bloodstream. It's an amazing group of things that you produce, and we don't even know where to, we're starting down this path, but it's going to be hugely, hugely important for our world, the natural world. And guess what? At the last microbiome meeting I attended, there are companies interested in this that are, drug companies, for example, but we own the corner on this. This is us. This is natural. We were the first. We're further into it. We can own this. We can own our own microbiota and make it better and do things with it. And we don't need to wait for, things to happen. We can own it and do things for it. So it's a really great opportunity for all of us. So now we're on to Endocrine. So I've kind of given you all the behind the scenes of Endocrine. Label's kind of light. You probably have one on your desk by now. Okay? You don't see the label here, but look at the ingredients. This is a small batch. I should probably tell you right now. We did these pre-batch. We did the testing. We did the analysis. We did all that stuff. All the ingredients have arrived for the large one, so it won't be available for about 3 weeks to go through all the testing and stuff, the manufacturing. We wanted to make a small one to make sure it met muster, so to speak. That's what you have in your hands. So, back to this chart. So my summary before is essentially a precursor to what was included in the formulary, right? What's included in that product. We include those herbal components, the few more potent brassica components, the Chinese, the Ayurvedic, the probiotics are in there, right? There's 2 probiotics that are absolutely critical for the healthy urogenital or vaginal tissue. So now let's talk protocols, and then I think I'll have time for questions. I probably have like 15 left or so, right? I'm just going to throw this up here again. Your other speakers will give a lot more on this, but just by looking at the pictures I drew, the brain, the feminine, and the gut, right? That little circle, easy things to include, right? You've got Endocrine, F+, calm. Now calm carefully, because if they are already androgen high, you could drive that up, because calm has a little bit of DHEA in it, so you got to be at least aware of that. Fiber, no question. We want to feed the bugs. Because one question that I figured I'd get, and I'd probably, preempt it, we're going to be orally taking these, but they do make it into the urogenital. And the most likely route people have, we follow these organisms. They make it right into the vaginal tract just nicely, and it's probably through the short distance between the rectum and the urogenital, because they get there and they set up house and they love it, right? So it does make it orally. You can speed it up by doing suppositories, but they'll get there. Little graphic, sorry about that. Number 1 and GB. Why do you think number 1 and GB are so critical right here? You're going to have to go all the way back to the beginning. Yep, HPA. Remember the hypothalamus pituitary? Critical, right? And we don't talk about number 1 much, but it's critical, and GB either. And GB, I'm hoping this reignites some interest in GB, because GB for us is kind of a sleeper a little bit, and it's really a powerful, powerful formula. These 2, number 1, you probably didn't know, is the hypothalamus. I should probably point that out. It's not GHA or anything. There's the hypothalamus and there's the pituitary, so that's why those were there. And then if you want to look adjunct, right, if you want to take this deeper, we can look at EPIC for the adducts, right? N-acetylcysteine and EPIC, it reduces these adducts, right? It gets in the way of forming those estrogen adducts to DNA. It blocks that. So it's kind of it gets in the way of creating damage. The insulin dysglycemia, especially people that are high, women that are high in androgen or those other insulin, right? Can't look away from that. CVO, I think, yeah, Sarika mentioned something about, you look at a lipid profile, lipid profiles run hand in hand with this and hand in hand with this, right? Because of their intimate relationship. So lipids are important. Cholesterol, the HDLs, the particle sizes and all that we've talked about in the past. So CVO, neurosyn, the neurotransmitters, no doubt about that. Then the MORS, that's all phase 2. So if you are worried, getting a woman from what she's been doing, whether it's HRT and so on, you want to help the detox process too. And there's others here. I just threw a few up. I don't want to really, these are really simple and I don't want to go, these are like really boring, but exercise is critical. Beyond the look at this and your diet, which is getting better, the yoga, the exercise, not high impact if you're not into that, it does change hormonal responses, just like emotion. And I'm going to, the last thing I'm going to say is, I love the herbs and herbalomics and genetics and this biochemistry and all that. But honestly, one of the things that drives serotonin, dopamine, healthy is your emotional relationships, your health in emotions. When your emotions take a dive, you can throw biochemistry out the window. You're beating yourself up left and right at the cellular level when you're not happy and you're not in a good place. We've looked at the DNA and all that things. You're causing yourself all sorts of damage when you're not emotionally in a good place. That's just the way it is. And if you don't believe me, go look at the orphanage studies that were done in Russia and other Russian states. When those children were not cared for, they have so many problems because they didn't get touch, care, emotional support. Essentially, love is, that's the bottom line. That's critical to this whole process. Biochemistry is going to take a second seat to that, right? So that being said, I think that is it. It is it for me. And you got the product? Right on.